Hi, I am Dr. Sweta Gupta, Clinical Director, Medicover Fertility. Today we are going to discuss about sperm morphology. What is it? How is it diagnosed? What is the difference between normal and abnormal sperm morphology? What is the impact of abnormal sperm morphology on male infertility? And how can Medicover Fertility help with abnormal sperm morphology? What is sperm morphology? Sperm morphology refers to the shape and size of the sperm as observed under a microscope. It has three parts: head, midpiece and tail. Head piece or the head shape is considered the most important part because it affects the sperm's ability to enter the outer surface of egg and to fertilize it. How is sperm morphology test performed? A sperm morphology can be seen in routine semen analysis test. For the test, we need a fresh semen sample from patient. From that sample, a drop of semen is taken on a clean glass slide. It is then dried, stained and observed under a microscope to determine the percentage of normal sperm. When the sperm morphology ranges from 4 to 14%, it is considered normal, which means that the fertility potential is good. A sperm morphology less than 4% means that it will take a longer time for a man to impregnate a female. The shape of the sperm gives us an insight about sperm development or spermatogenesis that happens in testes. Men with a defect in sperm maturation tend to have problems with sperm morphology, and that may in turn affect fertility of man. What is the difference between normal and abnormal sperm morphology? Normal sperm morphology. For a sperm to be considered as normal form, it should have an oval head with normal connecting midpiece and a long straight tail. It should be free from any defects, like head should be smooth, the acrosome tip should have 40 to 70% of the head of the sperm. The head should not contain vacuoles. The midpiece or midsection should be thinner than the head, and the tail should be thinner than the head and midpiece. Abnormal sperm morphology, also called Teratozoospermia or Teratozoospermia, in which a large percentage of sperms have an abnormal shape. They may have a large deformed head, the midsection may be defective, the tail may be cooked or double-tailed, and at times large vacuoles may be present in the head. Normal sperm morphology is up to 4%. Less than 4% is considered abnormal, which means impairment or reduced ability to fertilize. What is the impact of abnormal sperm morphology on male infertility? In order for a man to be fertile, only 4% of normal sperm is needed. Just having abnormal sperms won't reduce fertility completely. There are other factors also like sperm number, sperm concentration, semen volume, percentage of sperm motility. An abnormally shaped sperm doesn't mean that in the genetic material in all cases will be damaged. In majority of the cases, it is healthy, but it has reduced fertilization rate. It means that he may need a longer time to make female pregnant. If natural conception is not occurring, he will require help of assisted reproductive technology. How can Medicover Fertility help you with an abnormal sperm morphology? Medicover Fertility is a renowned international brand. We have a team of highly skilled and experienced doctors who help couples with dealing with infertility. Medicover Fertility has a high fertility success rate as we use the latest technology in fertility treatments. Here the couples are carefully evaluated to find out the cause and the most appropriate treatment. Receiving a diagnosis of male infertility can be emotionally disturbing. A lot of cases with abnormal sperm morphology are dealt in Medicover Fertility. With the help of ICSI technology, we have been able to solve problems of abnormal sperm morphology. ICSI stands for intracytoplasmic sperm injection, where a man's sperm can be directly injected into the cytoplasm of an egg. Men with less than 4% normal forms of sperm can also father a child. ICSI requires only one selected normal sperm to fertilize the egg. Thank you for watching this video. If you have any concerns or questions regarding sperm morphology, you can drop your questions in comment section or call us on 7862800700. Do subscribe our channel for more informative videos.